What can you do right now if you are experiencing bladder issues? So here are some tips that you can start trying right now to see if we can help get you back in control of your bladder. So first and foremost, avoid bladder irritants. Water is your friend and pretty much the best thing for you to be drinking. We want to think about avoiding things that have caffeine in them and artificial flavorings. Spicy foods and acidic foods can also be bladder irritants. The biggest one usually tends to be caffeinated things. So sodas, teas, coffee, that kind of stuff. Stuff with carbonation oftentimes is a bladder irritant. So know what you're thinking. You're like, Brooke, you're telling me to take out all the fun stuff. I'm not saying you have to take everything out 100%, but can we limit things? If you usually drink 4 cups of coffee a day, can you drink 2 cups of coffee a day? Can you do a cup of coffee and then a glass of water and then another cup of coffee so that we kind of dilute things with the water in the middle? If you usually drink regular, can you try going to half and half and then eventually to decaf? Soda, honestly, soda's all bad. I know it tastes good to a lot of people, but it's got artificial colors and flavorings in it. It's got a carbonation can be an irritation, and it also usually is caffeinated. So that's something that for a lot of people, they just need to stay away from for their bladder to be happy with it. So playing around with bladder irritants and maybe trying to cut some of those out of your diet can make a big difference on keeping your bladder happy. What you do when you're sitting on the toilet can also make a big difference to keeping your bladder happy. So first and foremost, don't go to the bathroom just in case. Just in case peeing, or jicking for short, because jicking just sounds bad, sounds like something you shouldn't do, is not something you should be doing. So if you are one of those people who go to the bathroom just in case when you leave the house, or you're about to go shopping at Target, and so just you don't feel like you have to go to the bathroom, but you go to the bathroom there just in case because you don't want to be interrupted while you're shopping. Just in case peeing gives our bladder false information that we should be going to the bathroom. So if I back up a little bit, our bladder is a fillable balloon of an organ that's got sensors, stretch sensors all the way around it. And those sensors are supposed to tell us or start to relay signals to the brain when it's time for us to think about going to the bathroom. And like I talked about earlier, it should be sending those signals when our bladder is about half full, is when it should start sending those signals. Well, if we're constantly going to the bathroom just in case, when we have less than half full urine amounts in the bladder, then our bladder starts to think, well, wait a minute, should I be telling her that we need to go to the bathroom? And we can start to train the bladder to tell us that we have to go to the bathroom with smaller and smaller amounts of urine in there, which eventually can lead to urgency, frequency, and leakage. So just in case peeing can put you down a slippery slope to dealing with more urgency, frequency, and urge incontinence. So please don't go just in case. All right, next one on good toilet habits. Don't push to pee. Moms are the worst at this one. We have very little precious time in the bathroom alone, so we try and get in there, push real fast to get the pee done, and get out. This is not how it's supposed to happen. We are designed to push a little bit to have a bowel movement, but on the urination side of it, we are designed to just sit down, let the reflex loops take action, relax, and let the pee come out. It's not supposed to be a situation where we have to push to pee. Pushing to pee puts extra stress and strain down through the pelvic floor, and over time that can be problematic. Sit and relax on the toilet instead. Take slow, big, deep breaths to let everything relax. Get your knees out wide and up higher than your hips. So I call it the guy reading the Sunday paper position because you're kind of leaning forward and your knees are out wide like a guy who's sitting on the toilet reading the Sunday paper. But a great way to do this is using a product called the Squatty Potty. You can go to squattypotty.com to look it up. I get no monetary reimbursement from the company. I just think they have a great product. I am 6'1" and I use a Squatty Potty in all the bathrooms in my house to get me in a good position to help the pelvic floor muscles relax and release to let everything just come out. So I highly recommend checking it out. So that's as it relates to toilet habits to make our bladder happy. Coming back to what should we do for fluid intake? Again, water is our friend You want to make sure you are drinking adequate amounts of water. Many people, when they're dealing with bladder issues, try to limit their fluids as a way to minimize their bladder issues. And unfortunately, when we dehydrate ourselves and minimize our fluids, our urine gets more concentrated and it is more irritating to the bladder lining, and that makes the bladder want to get rid of it even more. So we want to drink an adequate amount of water. There's actually no research that the 8-ounce glasses of water a day is what everyone needs, nor is there research that everyone needs to be consuming 2 gallons of water a day. Everyone's a little bit different, and I recommend you go by the color of your pee. The first pee in the morning should be a brighter yellow, and then every pee after that should be a pale yellow. If you are peeing a bright or dark colored yellow, then you probably need to drink more fluid. And if you are peeing clear, you're probably taking in too much fluid and can actually decrease your fluid amount. Other tips that you can do to make your bladder happy. You can practice the pelvic floor muscle contractions that we were just talking about as part of that core canister recruitment. So as a quick refresher, inhale, relax, exhale, pick up the marble or squeeze the pelvic floor muscle and draw the belly in and hold for a few seconds and then let it relax. This shouldn't be a contraction that we're trying to squeeze as hard as we can. This isn't the Incredible Hulk style of recruitment. It's a gentle recruitment that, again, is a hidden exercise. No one should know that you're doing it. But practicing that, honestly, I recommend doing 10 contractions at a time, breakfast, lunch, and dinner, just to get in the habit of it. Or anytime you are breastfeeding your kid, if you've got a young kid, anytime you're stopped at a stoplight or stuck in a carpool lane, these are all great times to kind of remember to do it. Try engaging your pelvic floor muscles functionally throughout the day. So like we talked about before, squeeze before you sneeze so that you minimize the pressure down through the pelvic floor. Exhale when you're exerting yourself, when you're lifting something heavier, when you're standing up out of the chair. Don't hold your breath for it. So these are all things that can help to improve bladder issues if you're dealing with them. And what's the number one thing that you can do if you're experiencing bladder issues? I bet you can guess if you've been listening to this lecture for this far. That's right. Partner with a pelvic physical therapist. So bladder leakage is one of the most common diagnoses that we work with here at Legacy Physical Therapy on a day-to-day basis. And our 5 expert pelvic physical therapists love helping people get rid of their bladder leakage and be active any way they want without having to worry about taking medications, recovering from risky surgeries, or just experiencing bladder leakage day in and day out. We love getting people back to working out the way they want to, or maybe it's working on getting people to be able to increase their time between voids from going every 30 minutes to now going every 2 to 3 hours so they can go out to dinner with friends and not be worried about where the bathroom is or how much they're going to miss. We've worked with people who simply just want to be able to pick up their grandchildren without worrying about leaking. They're changing their grandkids' diapers and they don't want to be changing their own. So a pelvic physical therapist is an excellent resource to give you conservative treatment options to help overcome bladder issues. And that is something that you should highly consider if you are experiencing any type of bladder issues.
Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.